Hello friends, welcome to my channel. Today's video we are going to learn about abruptioplacenta, its type and also the causes, management of abruptioplacenta. Abruptioplacenta, also known as placental abruption, is the separation of the placenta from the wall of the uterus. It especially occurs after 24th weeks of gestation before the delivery of the fetus, and it is most common during the third trimester of pregnancy. Next, we will see the varieties of the premature separation of placenta. It is usually of three varieties. First one is revealed. Okay, revealed is when the separation of the placenta occurs followed by the expulsion of the blood by the vaginal tract. I repeat, in revealed, the separation of the placenta occurs followed by the expulsion of the blood from the vaginal tract. It is called as revealed. Whereas concealed is where the placenta gets separated but the blood starts getting collected between the membranes and the decidia. And the third is mixed, means it is a combination of these two, that is revealed and concealed, where some part of the blood collects inside the membranes and some part is expelled out. So that is why it is called as mixed. So there are three varieties of premature separation of placenta. It is revealed, concealed and mixed. Next we will see the types of abruption. So types, it depends upon the extent and to what region the separation of the placenta has occurred. So there are three types of abruption. The first one is complete abruption. The name itself is telling you that in complete abruption, the entire placenta gets detached from the wall of the uterus. I repeat, in a complete abruption, the entire placenta gets separated from the wall of the uterus. And the second type is partial abruption. In partial abruption, it occurs when part of the placenta gets separated from the uterine wall. Means here only a part of a placenta is getting separated from the uterine wall, and that is why it is called as partial. Means a part of placenta only gets separated. And the third one is a marginal abruption, when the separation is limited to the edge of the placenta. Means here the placenta gets separated only at the edge. So that is why it is called as marginal abruption. So in types we have seen three types. One is the complete abruption, partial, and the third one is the marginal abruption. So this is a complete abruption and this one is a partial abruption, and the first image is showing you the marginal abruption where only the edge of the placenta is getting separated. In the partial you can see only a partial part of the placenta is getting separated, and complete where the entire placenta is getting detached from the wall of the uterus. As you all know, placenta is the one which supplies the oxygen and the nutrients that is necessary for the fetus. But what happens when the placenta becomes unhealthy, or it is getting abrupted, or there is some problem in the placenta? What happens? The oxygen and the nutrients are not sufficiently transferred to the fetus, and it can result in what? It can result in fetal hypoxemia, decreased amount of oxygen to the fetal growth, and it also going to cause delayed growth in the fetus. So what are the risk factors of this placental abruption? It is because of the following things, that is maternal hypertensive disorders, any habits like smoking, alcohol consumption and drug use. It may be because of primiparity, advanced maternal age, and the history of IUGR, that is intrauterine growth retardation, and also the use of anti-neoplastic drugs and anti-epileptic drugs can also be one of the reason for the placental abnormalities. And because of this type of problems in placenta, it is ultimately going to result in certain complications like preterm labor because of the detachment of the placenta from the uterine wall. Preeclampsia, mother is going to suffer from the variations in the blood pressure and intrauterine growth restriction of the baby. And I already told you, when the placenta is not able to provide proper nutrients and oxygen to the developing fetus, the fetus is ultimately going to suffer from growth retardation in uterus and also stillbirth. So these are the complications of the placental abruptions. Now let us see what are the clinical features of abruptioplacenta. A mother usually will experience pain and tenderness, but sometimes it is silent. The clinical features are silent because the bleeding, whatever has occurred, as we see in concealed type, the bleeding stays within the membrane, and sometimes it cannot be identified till there is some bleeding or pain. It remains silent. The other things are maternal distress due to loss of more amount of blood the mother, and often intrauterine fetal death can occur because of lack of nutrients and oxygen supply to the fetus, and complete abruption of placenta is going to result in the fetal death. So these are the clinical features that we see in abruption placenta. Next we will see the pathophysiology of this placental abruption. So because of the etiological factors, I told you many of the etiological factors responsible for placental abruption can result in hemorrhage within the decidia basilis, resulting in the separation of the placenta. So because of which there is a formation of hematoma in the decidia, resulting in the necrosis of the decidia basilis and also the adjacent placental parts. So this is the pathophysiology that we see in the placental abruption, ultimately resulting in the degeneration of the decidia basilis, resulting in the changes, the physical structural changes in the placenta, resulting in the placental dysfunction. Now we'll see the management of placental abruption. So the management depends upon the types of abruption of placenta, whether it is partial, complete, and marginal. So if at all, if the placental abruption has already occurred and has occurred completely, then we can go for early delivery in case of if the fetus is viable. Along with adequate blood transfusion, and analgesia may be required for relief of pain. And also we need to go for a detailed maternal and fetal monitoring, along with the monitoring of the coagulation profile of the mother, including DIC, that is disseminated intravascular coagulopathy, needs to be checked here. And we need to reassure that if the baby is distressed or if the bleeding is very severe and if the baby is alive or not, and whether the mother is in the advanced stage of labor, this needs to be reassessed. And if at all, if a complete separation has already occurred, we can better go for the vaginal delivery. But the indications for vaginal delivery is already the baby is dead and the cervix is fully dilated, then we can support the delivery with the help of venous delivery. And in case of conservative management, if the abruption is very small, okay, means if the abruption is very small, then the mother and the fetus well-being is good, then we can wait till the completion of the term, and we can go for their administration of steroids for the maturity of the fetal lung. So these are the conservative management that can be done in case where there is only small abruption of the placenta. So there is certain nursing diagnosis for placental abruption. The first one is acute pain related to uterine contractions. Second one is fluid volume deficit because of excessive blood loss. And third one is ineffective uteroplacental tissue perfusion related to the abruption of placenta. The fourth is risk for anemia. It's mainly related to the bleeding. And the next one is the risk for intrauterine infection. It's also almost related to the vaginal bleeding. And the last one is the risk for fetal hypoxia. It is because when the placental dysfunction occurs, the placenta is not able to provide oxygen supply to the fetus, resulting in the fetal hypoxia. Okay, so these are the nursing diagnoses that can be formed for placental abruption. Okay, friends, thank you for your patient listening. And if you have understood this abruption placenta, kindly like my video, share and comment, and expecting your support forever. Thank you.